85 NCLEX practice test. No fluff. Straightforward questions that shows up on the NCLEX concept commonly tested. Grab your pen and paper and let's go and keep track of your record. Question. This is in the new test plan on devices. Are you ready to answer them? This question will test your knowledge. A nurse is caring for 4 clients in labor. Which of the following clients will most likely require placement of an intrauterine pressure catheter? This is in the test plan that they want to ask you. A client with regular contraction every 3 minutes and reassuring fetal heart rate. A client with obesity who is constantly changing position with very active fetus. A client who is calmed and requesting pain relief during labor. A client with intermittent fetal heart rate variability on external monitor. Pause, answer the question, and I will give you the answer with the explanation, with the key concept you have to focus on. You pick your answer? I can tell you the right answer is B. Every time you see intrauterine pressure catheter, we use it. Usually we don't use it, but we use it if the mommy cannot stay still, moving around most of the time, changing position or walking around. These are pressure management that will be affected. Therefore, we need to do something that is accurate. And we're going to use intrauterine pressure monitoring. If you're having regular contraction every 3 minutes with reassuring heart rate, there's no need to put intrauterine pressure catheter. A client who is calm, requesting pain medications, not moving around, there's no problem. A client with what? Intermittent fetal heart variability on external monitor. This is a trap. The pressure monitoring is different from fetal heart rate. It does not measure fetal heart rate. So that's a trap. So pay attention, changing position, walking, cannot stay still, and they have obesity is another clue to do what? Do intrauterine pressure catheter. Question 1 down. Write the concept down. Take a picture of this because you will see it on your NCLEX. Trust me. Which defense mechanism is most likely demonstrating? What is the problem? Read it. This is mental health. Like I said, these are commonly tested questions. It's challenging. If you're making more than 65, you're on your way passing. A nurse is caring for a client who was recently informed that a co-worker has been promoted to a position that the client had applied for. During the interaction, the client stated, "I am so happy for them. They really deserve it," while smiling and speaking in an overtly cheerful tone. What is the problem? The nurse observed the client avoid discussing their own feeling about the situation and quickly changes the subject when asked about disappointment. The client has also been bringing small gifts and offering excessive praise to the co-worker since the promotion. The client denied any feeling of anger and resentment. That's the key. What do you think she's doing? Whoever the client is, what are they doing? Are they projecting? Are they displacing? Are they having a reaction formation on rationalization? Pick your answer. Let me know. What do you think? But I can tell you, this is a reaction formation. Inner feeling or an inner feeling is not being expressed. She usually talking about it. All of a sudden, they ask her about what? Disappointment, then change the subject. The client has also been bringing gifts and offering excessive praise to the co-worker. Deny any feeling of anger and resentment. This is reaction formation. The way the client feels is not being expressed. Projection means what? What you think you are, you projecting on somebody else. Displacement, you have bad feeling, put you on the other one. Rationalization, making sense out of it. That client is not making sense out of the situation. Reaction formation. And it's working in a mental health clinic is reviewing telephone message, mental health, psych nursing. Which of the following clients would the nurse return the call first? Prioritization, management of care, but it's a what? Mental health case. A client taking clozapine report feeling what? Drooling, pharmacology. A client taking Zapraxidone who report fainting spell. A client taking Prosperidone who report an inner feeling of restlessness. A client taking Quetiapine who report fever. These are all psych medication. Most all of them are antipsychotic. Which of these conditions is worrisome? Pause the video, pick your answer. But I can tell you the right answer is D. Why? Quetiapine, second generation antipsychotic with fever. That's neuroleptic malignant syndrome. Bad problem, bad problem, bad problem. A, don't pick it, is a trap. I'm telling you, don't pick it. Drooling is hypersalivation, common in clozapine. Ziprasidone, yeah, it's worse. It causes QT prolongation, and you may have fainting spell. But NMS is worse than fainting spells. A client with risperidone report an inner feeling of what? Restlessness. That's movement issue. It's less than NMS. That's what? Akathisia, extrapyramidal symptoms. This question, watch this area multiple times and master pharmacology associated with what? Antipsychotic. D is your real answer. Which of the following highlight information require immediate notification of the healthcare provider? That means bad problem. Select or apply. This is the problem. A nurse is assessing a newborn at 1 hour of following a vaginal delivery at 37 weeks of gestation. Have promotion, newborn nursing. The infant weight is about 7 pounds, 3 ounces. Is that okay? Assessment findings show the head circumference is 33 centimeters. Chest circumference is 31. Umbilical cord with what? 2 arteries and 1 vein. The patient has a weak cry with what? Minimum spontaneous movement. There's a breath sound that diminished with intermittent grunting. The body is pale with acrocyanosis. Apical pulses is 102. Axillary temperature 96.2. Respiratory rate of 68. Pulse 89% on room air, and AVGA score of 1 at 6 minutes. Newborn physical health assessment. This is what the content is about. Take a picture of it, look at it careful. If it's an expected finding, leave it alone. But which one should you notify the healthcare provider? Pick your answer. Don't overselect. Select those that you are 100% confident. You pick yours, pause the video and pick yours. Now, chest circumference 31 centimeters. The chest circumference, you can get an answer from head circumference. Head circumference is 33. The difference between them is between 2 to 3 centimeters. Therefore, that's good. Umbilical cord with 2 arteries and 1 vein. That's normal. Patient has a weak cry. We don't like it. Bad problem. Grunting, respiratory problem. Pale body with the what? Acrocyanosis. That's good. It's not bad. Apical pulses of 102. It looked normal. But remember, kid, newborn, heart rate is what? 110 to 160. This is bradycardia. Temperature 96.2 is hypothermia. Respiratory rate is over 60. Bad problem. AVGA score of 6. That's not normal. We got to keep on doing it until we get something close to 9. Therefore, that's your answer. Watch for this newborn assessment. Which one is bad? That's what you think. This will make the test reliable, common, like you see the NCLEX bunch of pictures. This is a common question recently asked on the NCLEX. Specifically, a picture shown to the student, the nurse, and say, answer the question. And nurse is preparing to admit a client from emergency department who has what? Rash shown below. Which of the following infectious control precautions should the nurse implement? Select or apply. You click on it. This is what you see. What can you picture from this image? What can you see? What kind of rash is it? How do you describe it? And what kind of infectious control should you institute? Place the client in a semi-private room. Require the use of non-sterile surgical masks. Wear gown and gloves when providing care. Require the use of N95 respirator. Institute single-use equipment. This is the condition. Figure out what is this. If you figure out what is this, whatever you want to place it, and then you can design what infectious control protocol you should institute. You pick your answer? Good. I know you got it. But as you can see, the rash is on the trunk, the body, right? And you can see that there's changes. You can see vesicular lesions, like vesicles, like here. And it's on the erythema base. This is what we call dew drops of rose petals. It looks like rose petals, right? These are vesicular lesions. Some are crusted, some are not crusted, like the small, tiny ones. Yeah, this is what we call dew drops. On the rose petal, we have vesicles on erythematous base. And the kid is moving from head to down. This is varicella. If this is varicella, we do what? This is contact and airborne. If that is so, We don't put the kid in semi-private room if it's contact or airborne. You stay in what? Private room alone. Require the use of non-sterile surgical masks. You need N95. You wear gown and gloves when providing care for the contact. You require the use of N95 for the airborne. You should institute single-use equipment for the contact. That's the right answer for this question. These are the concept dewdrops on the rose petal based on the picture. And this is caring for a newborn whose parent had what? Rubella during pregnancy. Mother had rubella. Which of the following conditions should the nurse anticipate in the newborn? That means the mother has rubella, and then the newborn, after it's delivered, what do you think you should see? Select or apply. Cataract, sensory, neural hearing loss, patent ductus arteriosus, neurotube defect, macrocephaly, strawberry blue muffin rash. This is why we don't want the parent to have rubella. But of course, mommy has rubella, baby has been delivered. What do you anticipate complication associated with this condition? That's the buzzword. I've analyzed the question for you. Rubella in the mother, and I have this condition you should expect in the newborn when they're born in the future, or what do you expect? Pick your answer, let me know, and I'll break the question down as I've done to you. The complication associated with rubella, I call them the 3 C's. 1 is cataract. 2 is cardiac defect. Do you see a cardiac defect? Patent ductus arteriosus. C is a cochlear hearing problem. That's sensorineural hearing loss. Those are the 3. You have a cataract, eye problem, cardiac issue, and a cochlear. Neurotube defect is a trap. It's just associated with what? Folate. Therefore, don't pick it. The kid head is going to be small, microcephaly, and they're going to have rash called strawberry muffin rash. This is the condition associated with rubella in the newborn. And this is made aware for client. This is prioritization, management of care. Which of the following clients should the nurse assess first? A client who is 24 hours post-operatively following a colostomy with a beefy red stomach. A client who is 4 hours post-cardiac catheterization, positioned at 45 degrees. A client with diabetes who is 4 hours after receiving insulin glargine. A client with diverticulitis who reports left quadrant abdominal pain. As usual, you know the B-sharp, adapt and close way, breathing, electrolyte shock, sepsis, airway, pain problem. Find out which one is expected. If it's unexpected, ignore it. If it's not expected, that's your right answer. That's all. How do you know? Just divide it into 2. Right answer is B. Why? Post-cardiac catheterization, you should never be positioned supine. That's hemorrhage. That leg in the body flat. You can raise the head up but still flat. 45 degrees. That can create hemorrhage, hematoma in the groin. If you have colostomy and it's 24 hours, it's beefy red, it's an expected finding. If you have diabetes, I give you glargine, it's a long-acting. I should not worry about what? Hypoglycemia. If you have diverticulitis, you're supposed to have left lower quadrant pain. This is the way you do prioritization. Don't overthink it. Ask yourself, what they're telling me, is this what I expect? Is this normal? Is it B-sharp? And if you know it's a bad condition, think about it. Is it a breathing, electrolyte shock, sepsis, airway? And then figure out which one is the worst one. That's all. B is the right answer. Another, infectious control. Like I said, don't panic, I got you. This is what you should be expecting. Now they're giving pictures of infectious control. You'll be able to diagnose it. So know the rash, know how it look like, and I'm giving you features. And then preparing to admit a child with the rash shown in the image. Which of the following infectious control prevention should the nurse implement? Select and apply. Don't over-select. Click on the image. This is a rash. And then these are oral examination. You have to be familiar. These are key concepts associated with this infectious control problem. This is the kid. You start from the head, running down. You see erythema, you see the mouth, you see that thing over there? Please know it. What do you think? Drop red precaution. Place a surgical mask on the client during transport to radiology. Wear a surgical mask for the routine care. Place the client in a negative pressure room. Wear a gown and gloves during routine care. It will be difficult to guess, but sometimes you can guess based on the answers you can give. But I try to like put different answers there. You don't know which one is there, but you can manage and figure out if you know the answer. If you not, look at the rash and pick the rash that you think is going on. You pick your answer. This is not varicella because you don't see the vesicles like the one we saw. We see erythema base. That's all. And then when you look at the Cape map, this is classic for that condition. If NCLEX give you, it has to give you this rash plus the mouth, white patches over there. This is what we call couplet rash. And this is consistent with what? Measles. This is classic measles, rubella. This is rubella, not rubella. This is rubella. It's airborne precaution. It does not include contact like varicella. If it's airborne, then A is wrong, not droplet. Place surgical mask on the client during transport to radiology. Yeah, that's what you do when you're on airborne precaution. Put a surgical mask on them. Wear surgical mask for routine care. Wear N95. Place client in a negative pressure room. Yes, that's what you do. Wear gown and gloves during care. Like I said, there's no contact. But if it's varicella, there's contact and airborne. This is usually airborne alone. So that's the right answer. Watch the rash, copy this, take a picture of it. When you see it, you know this is rubella. A registered nurse and a UAP provide care for a client. This is what? Management of care, delegation, right? Which tasks the nurse should safely delegate to the UAP, reinforcing teaching on the side effect of the prescribed oral drops, assess for high irritation, performs learning charge tests, provide teaching on the proper use of a contact lens. They all work in the high exams in the clinic. Which one do you think a UAP can do? Pick your answer, let me know. And keep your track of your score. The right answer is Snelling test. There's no thinking. There's nothing you need to do. You show the patient the chart and they read it and record it. Teaching is not in the vocabulary of a UAP. Assessment is not in the vocabulary. Teaching is not in the vocabulary. C is your right answer. Just collecting data. This is also prioritization. You got to be sharp. Whose condition is worse? Which of the following prescriptions should the nurse implement first? And nurse is reviewing prescription for several clients. What do you think? The one you can institute first is the one that is going to help the patient most. Unless they are in certain problem, then you give it to them. Initiate IV fluid for a client is dehydrated with a heart rate of 105. Is that number one thing you should do? Initiate heparin infusion. Client is diagnosed with pulmonary embolism compared to one. Who medication should we give first? Apply oxygen on a client, nasal cannula for client who has a COPD. His saturation is 89. Is that more important than giving the heparin for PE or IV fluid for dehydration? And the last one, give them insulin glargine for a client who has type 2 diabetes. Which one is more important? Pick your answer, let's see. I can tell you, right answer is pulmonary embolism, airway issue. We need fast medication to help with that. Otherwise, they get into trouble. Dehydration, of course, you're tachycardic, but that does not trump pulmonary embolism. And then COPD patient saturation is 89. Nothing wrong with it. There's nothing in the question that tells you this patient is in trouble. Don't worry about it. Because it's oxygen, you want to pick it. It's a trap. And glargine is a long-acting. I'm not going to worry about that patient. Next generation form of question. You know it, so don't worry. It is maternity health promotion. Which of the following findings indicate the client is in the transition phase of labor? This is stage 1, transition phase. And this is assessing the client who's in labor. Which one shows transition phase? Cervical dilation, 8 out of 10 centimeters. Cervix is about 80 to 100% effaced. There's a presence of Ferguson reflex. There's contraction 2 to 3 minutes apart, and there's moderate contraction. What do you think? Is it yes or no? Transition phase. You pick your answer. I will tell you strategy when you want to know the phases of stage 1 divided into 3. Phase 1 is here, that's latent. Phase 2, active zone, and the transition zone is here. How do you divide them? This all has to be 100%. And therefore, this is 30. This will be what? 70. This will be 80 to 100%. Centimeters is the same. 3 centimeters. This is 4 to 6 centimeters. and this is 8 to 10 centimeters. That's all. Therefore, which one? You pick your answer choice. 8 to 10 centimeters consistent with transition because it's at the end of it. 80 to 100% transition phase is at the end of it. Ferguson reflex, the intense feeling of you want to have a bowel movement, yeah. And the contraction very, very short, 2 minutes apart. Transition because I'm going to stage 2. And the moderate contraction. Contraction are severe, they are not moderate. Therefore, this is not what you should expect. So these are the answers you will see. At transition phase, contraction are short, severe, intense. The cervix has to be like 8 to 100 centimeters, and they have to be phased and dilated 8 to 10 centimeters. This is the point that you start worrying about the test. 10 questions. Depending on what you do, you may be above the passing level or maybe below. This is where you tighten yourself up, try to remain above the passing level. Keep track of your score and see where you are. If you're scoring over 80, 65 after 10, 11 questions, you are above it. If not, let's keep ourselves up and keep on going. Which of the following clients should the nurse return the call to first? Prioritization, of course. They will hit you with prioritization. And you say, a bunch of it. Yes, stay focused. Which a nurse working in the clinic reviewing telephone message for 4 clients. A client with taking phenotide, it reports swollen gum and dizziness. Client taking methotrexate, you report mouth sore and low-grade fever. Client taking clozapine, you report fatigue and sore throat. A client taking sildenafil, you report what? Mild headache after use. 11 questions. This is question 12. Which one? Prioritization. Who you need to call first? They call you. They are taking medication with side effect. Pharmacology prioritization. I can tell you, C is the right answer. I know the answer choice you will pick. You pick B. It may be 50-50. Don't pick methotrexate. I know sore mouth and low-grade fever. This is due to what? Myelosuppression. And they may have what? Sepsis associated with it. But clozapine with fatigue and sore throat, that's what? Agranulocytosis. They look the same like B, but C is more dangerous. Agranulocytosis is more dangerous. B is myelosuppression. So they're more likely to have low-grade fever and sore throat, but you still have to worry about it. Phenotype with swollen gum and dizziness, this is what? Gingival hyperplasia. It's not a problem. In sildenafil, you're going to have orthostatic hypotension. My headache is normal, associated with it due to vasodilation. C is your right answer. Which of the following actions should the nurse take? Management of care. A nurse is caring for a client admitted with what? Rare dermatologic condition, that means skin condition. Later that day, the nurse posts a personal social media account. This is social media etiquette. This is what was on the test plan. That's why these tests represent what you're going to see on the NCLEX. Just care for a patient with the widest skin condition I've ever seen. This is what she posted. The post does not include the client's name or room. No name, nothing. Just stated that they saw a condition and this is what you saw today. Which of the following the nurse should take? Delete the post and report the incident to the supervisor. Leave the post because no identifying information was included. Edit the post to remove the word patient. Make the post private. What do you think? Based on what she said, just care for a patient with the widest skin condition I have ever seen. There's no name, there's no room, there's no hospital. What do you think is the best ethical thing that the nurse should do? Management of care. You pick your answer. HIPAA violation. Delete it and let the supervisor know whether the name or patient name or anything on it is not on it. That's no matter. This is still a violation. Don't post. This is what the NCLEX want you to focus on because it's happening in real world. What do you think? Physiological adaptation. EKG. I got you. And then provide care for a client with the new finding on telemetry monitor. What are the steps the nurse should take based on the information provided? This is what you have. What do you think? Can you recognize it? That's an EKG. What do you do? Repeat adenosine dose, place IV in anticubital perfuser, continue monitoring, monitor the client, administer adenosine, flush it, order it in order. Even if you can't recognize this answer choice give you a clue. You pick your answer, which order should you arrange them? I can tell you, this is supraventricular tachycardia, SVT. And therefore, the first thing we do, we're going to put the patient on a cardiac monitor to monitor them. We're going to have IV in place because we got to give them medication. Then we give them adenosine very fast, over 1 to 2 seconds. Then you got to flush it. And then what do you do? Monitor the client for chest pain because that's what they're going to, their heart is going to stop. Then you can decide to repeat the dose if they have not responded. This is what you do for SVT. Master it. And this is caring for several assigned clients. Which of the following client situation require follow-up? A client with what? Pneumonia receiving oxygen via non-rebreather mask with the oxygen saturation of 91. A client with what? Bronchitis who is ambulating in the airway while receiving oxygen via nasal cannula. A client with what? Pneumonia who apply oxygen via nasal cannula before ambulating. A client with asthma who is in tripod position, wheezing, and receiving nebulizer treatment. Whose condition require follow-up? Whose condition is bad that you need to intervene. Don't get trapped. I know the answer you're going to pick, but don't pick it. Don't pick it. You're attempting. Don't pick it. You pick your answer. I can tell you one is your right answer. Why? Ask yourself why. He has pneumonia. Fine. But he's getting non-rebreather oxygen. That should give you over 100% oxygen. It's very, very high oxygen, high flow. Saturation is still 91%. That means patient is not doing well. Non-rebreather oxygen and you citing 91, bad problem. If you have bronchitis, when you're walking, you can take oxygen with it. There's nothing wrong with it. If you have pneumonia and you're walking and you're using oxygen when you're walking, that's fine. You have asthma, you're in tripod position. Okay, bad. You're wheezing. Okay, bad. But we're treating you. What can we do? You're getting your treatment. Therefore, don't pick. Number 4, I know you're going to pick it. Asthma, tripod position, wheezing. But what are we doing? Receiving nebulizer. Number 1 should be getting 100% oxygen. You should not saturate 91%. And this is assessing a 7-year-old client who has what? Tonsillitis. This is what? Pediatric respiratory question. But it's the same thing as what? Physiological adaptation, which finding will require follow-up. Difficult to swallowing, large swollen lymph node, and temperature 101.5. Muffled hot potato voice, red, beefy red, strawberry tongue. These are what? Strategies you can answer this kind of question. When you pick the answer, I will tell you. You pick yours? Look at it. They say which one requires immediate follow-up. There's going to be expected finding every time you see this kind of question, and they look worrisome. Tonsillitis, I should expect fever. Why do you want to pick B? Don't. Tonsillitis, when you swallow, when you have sore throat, it's difficult to swallow. Don't pick it. Tonsillitis, your tongue is going to look red. But if you have muffled hot potato voice, that's airway obstruction. It's like drooling. You do drooling for what? Epiglottitis. These people, when you have hot potato voice, that means they can't swallow their saliva. That's a bad problem. That's what you see, airway obstruction. Another picture. Once again, master infectious control. As you master them, know the pictures associated with the condition. And client present 24 hours after hiking in the wood. That's the buzzword. Wood hiking. What will be there? With the red, itchy rash and blisters shown below. Which infectious control measures should the nurse implement? This is what you see. What do you say? What do you think? Contact precaution, droplet precaution, airway precaution, standard precaution. Don't overthink it. Focus on the buzzword, wood. What will be in the woods? You pick your answer. That will look like that. This is a standard precaution because this is what? This is what? These look like poison ivy. You get yourself in contact with something and you have these vesicular lesions, but these are all normal. There's no infectious associated with it. There's nothing in the wood that you go in the wood and you get the rash that will require you to be isolated. You get Lyme disease from tick. There's all standard precaution. You can say contact, droplet, airborne, gone. A nurse is caring for a 9-year-old client diagnosed with varicella. The nurse is providing district teaching to the parent, infectious control. Which of the following instructions should the nurse include? Select or apply. Even though it's infectious control, this is risk reduction question. Keep the client home until the lesion have crusted. Administer aspirin and acetaminophen for fever. Trim the child's fingernails. Contact the school to report your child illness. Use calamine lotion to reduce itching and encourage the child to scratch the lesion to relieve discomfort. Pause the video, answer your choice, and let me know. Select or apply. Don't over-select. Pick those that you're confident, but focus on the buzzword. It's a varicella. You know it's airborne and contact. What kind of teaching you provide the parent? I can tell you, one, we wait until the lesion are crusted. That means the kid is no more infectious. Then you can go out. Number two is a trap. Don't pick it. There's aspirin there, acetaminophen. It cannot be all. Kid with viral infection cannot have what aspirin product. They can have acetaminophen, but not aspirin. So don't pick it. The kid is going to scratch themselves and they're going to break the skin. They're going to get more infection. So trim their fingernails. You should let the school be aware of because they may have get infected before they get the rash so that they can test other kids. Calamine lotion is soothing to the skin and reducing the itching. You should not encourage the kid to scratch themselves. This is risk reduction, infectious control strategy on varicella. No, this is very good on pediatric question you may see to teach parents on varicella management. And this is providing teaching to a client diagnosed with what? Genital herpes caused by herpes simplex infection, infectious disease, and the head promotion, which statement by the client indicate correct understanding of the teaching. Herpes simplex, very testable. Select or apply. Contagious, only the lesion are present. Using condom will eliminate transmission risks. This infection can be cured with the treatment. I should avoid sexual contact with during an outbreak, and then antiviral medication can help reduce outbreak. I should inform sexual partners about my diagnosis. I can transmit the virus even when I don't have symptoms. What do you think? Pick your answer, let me know. But this is herpes simplex. And I can tell you, one is wrong. You can be contagious, whether there's vesicles or not. So bad. Using condom does not eliminate. Condom does not completely eliminate. It reduces the risk of transmission. So elimination is wrong. This infection can be cured with treatment. There's no medication that can cure the HSV in your blood. It's engraved in your DNA. You cannot get rid of it. I should avoid sexual contact during outbreak. Yes, you should not have sex at that time. Antiviral medication will reduce the outbreak infection, but it does not eliminate it. I should inform my sexual partners about my diagnosis so that they should be aware of it. And you can transmit it whether you have symptoms or not. So that's it. Nurse is caring for 4 laboring clients who has requested IV pain medication. Which client is safe to receive butafenil? This is opiate, and we use it in labor. You have to know indication for these medication. 38 weeks pregnant, in active labor, is dilated 6 centimeters, and it has no medical history of substance abuse. Whenever they ask you this question, you have to know key fact. A 32-year-old pregnant client is in early labor with mild contraction and no medical history of hypertension. A 40-week pregnant client in transition who is dilated to 9 centimeters and has a history of opioid addiction. A 36-week pregnant client in active labor who is dilated 5 centimeters and report history of asthma. There's contraindication and indication for this. Pick your answer, let me know, and let me give you the indication. I want you to write it down next time. When you see this question, you master it. But I can tell you which one is the right answer. Is A. What do you mean? This is given before anything after 36 weeks. You have to be most likely in active labor because then you have time to the opioid to get out of your system. And you should not have any use of opiate. Otherwise, you go into withdrawal. Look at 30B. Less than 36 is gone. Therefore, we don't have to give it to you. 40 weeks pregnant client is in what transition, that means past active phase. Why would you give it to them? And they use opiate to gone. 36 weeks, okay, in active labor, okay, dilated, but as a history of asthma would depress the respiratory drive. Therefore, one is your right answer. So contraindication is asthma patient, somebody who use opiate, and if you less than 36 weeks, and if you pass the active phase, you can have it. And hence is preparing to discharge the child after treatment of dehydration. Which of the following instructions should the nurse include to promote what? Hydration at home. Select or apply. This is the kid. 3-year-old child brought to the clinic by the parent. The parent reports that the child has been vomiting and have diarrhea for 2 days and has not been drinking fluid well. The parent states the child has had only one wet diaper in the past 10 hours and appear lethargic and less responsive. These are their vitals. It lost about 1.8 pounds over the past 48 hours. Dehydration. The mucous memory dry. Sunken eyes. Decreased skin thirger. Capillary refill longer. We initiate fluid 20 ml per kilo isotonic. All this is telling you dehydrate patient. We resuscitate the patient. The nurse is preparing to discharge the child after the treatment. Which instructions should the nurse include? Offer oral rehydration solution frequently in small amount. Provide watermelon and cucumbers at each meal. Encourage intake of soda and fruit juice to increase fluid. Offer banana, strawberry, and other easily digestible food. Give large amount of fluid at once. And offer broth-based soup and gelatin. Which one will help hydrating this kid? That's all. You pick your answer. Select or apply. Don't over-select. Don't pick everything. But I can tell you, offer rehydration frequently is good. Small fluid is better. If you give them large amount, they're going to vomit. That's why E is wrong answer. Watermelon and cucumber hold on to water. They have a lot of water. If you want to hydrate the kid, give them watermelon and cucumbers. Soda, fruit juice, dehydration, too much sugar. Banana, strawberry, hold on to water. Easily digestible food is very good. It has water in it. Large amount of fluid, you're going to vomit. And broth and soup and gelatin has some electrolyte in it. This will help with the kid. 22. A nurse is preparing to administer a rectal suppository to a client. Which of the following actions should the nurse take? Position the client in the supine position. Insert the suppository past the external anal sphincter. Instruct the client to remain in same position for at least 5 minutes after the insertion. Ask the client to bear down during insertion. How do you give suppository? What are the things you have to do? Medication administration, safe medication administration. Pause, pick your answer. C is your right answer. Why? Same position, right position. Patient need to hold it for some time, 5 minutes, so that he can stay and do his job. Why? 1 is wrong, it's not same position. Why 2 is wrong? You pass the internal sphincter, not external sphincter. Watch for this trap. A lot of people will pick B. Don't pick it. It's internal sphincter. Ask the client to bear down during insertion. They're going to get rid of the suppository. They should not bear down. Hold it. A nurse is caring for a client who is prescribed spironolactone. Which of the following medication are contraindicated for this client? Select or apply. Lisinopril, furosemide, metoprolol, amlodipine, Placenta, aliskiren, and heparin. Which one is contraindicated in this patient? This is pharmacology. You pick your answer? I know you know. Spironolactone will do what? Hyperkalemia. If any of this is going to cause hyperkalemia, they should not take it. Lisinopril causes hyperkalemia. Furosemide causes hypokalemia. So you take it with spironolactone. Metoprolol has no effect on hyperkalemia. Amlodipine is a calcium channel blocker. No effect. Irbesartan is an ARB. It causes hyperkalemia. Aliskiren is what? Also renin inhibitor in the process causes hyperkalemia. Heparin will lead to what? hyperkalemia because it's blocked aldosterone. So these are medication that can lead to hyperkalemia if you're taking less. And spironolactone, you should not take it. Next generation NCLEX. This is the time. Question 24. People get tired, they get weaker. But I want you to remember that this, you should stay with me. This is how you build your stamina. This is how people fail the test. At this point, they're tired. They try to go through this, they want to like rush through this case study. But no, stick around, watch the way we're going to approach it, and then master the content. Client with G1P0, 30 weeks pregnant to the labor and delivery with painless vaginal bleeding. That's buzzword. If you see that, anything that follow, you should match it with painless vaginal bleeding. No documented prenatal care. That means never had a prenatal care. Client reports sexual intercourse, 48 hours. Is that what was causing the bleeding? Ask yourself. Deny any illicit drug use. Immunization is up to date. The vitals look normal. Heart rate 84. Everything is stable. Patients are left-oriented. The abdomen, the uterus is gravid because there's a baby there. No tenderness, no leg edema, no signs of preeclampsia. I'm just bleeding painlessly. Fetal heart rate 130 is fine. When you do ultrasound, you saw a pulsator. Something is pulsating. What is that? It's a vessel. It's cord-like structure. It's covering the cervical os. What can cover the cervical os? And there's blood vessel in it. What do you think? And the mommy has painless vaginal bleeding. This is your buzzword. This is your buzzword. And use it to answer the question. After reviewing the client clinical finding, the nurse should identify that the client is most likely suffering. Is this a threatening abortion? Is this placenta accreta? Is this placenta abruption? Is it placenta previa? Look at it again. Painless vaginal bleeding at sexual intercourse. This finds pulsating cord-like structure covering the cervical os. This is the buzzword you should focus on. But I can tell you this Previa. Abruption is painful. Eliminated. Accreta is usually embedded in the uterus. There's nothing that like that. And threatening abortion, bleeding is painless, but usually no evidence of contraction or anything like that. Therefore, D is your right answer. Which of the following is indicated in the plan of care? If this is Previa, what would you do? Sterile vaginal exams every 4 hours. Initiate strict bed rest. Insert 25 gauge needle. Type and cross and match. Prepare for immediate C-section for delivery. What do you think? What do you think? I can tell you, A is wrong, no vaginal exams. But mommy should remain bed rest. You got to give them fluid, blood. 25 gauge needle is too small. 18, 16, 14, good. Type and cross match is good. Mommy is stable. There's nothing going on. You don't need immediate C-section, cesarean delivery. We just need to monitor the mommy until they start getting sick. Hypotension, shock, then we got to take them to surgery. The nurse is preparing to discharge the client. Now patient is going home. The client vaginal bleeding has resolved. It went away. Which of the following instructions should the nurse include in the teaching? So you're getting them ready, you're teaching them. What do you tell them? Avoid sexual intercourse until cleared by the provider. Perform daily fetal kick count. Report any vaginal bleeding immediately. Avoid vaginal examination unless prescribed. Engage in strenuous exercise to prevent improve circulation. Maintain pelvic rest. Report to the labor and delivery unit only when in labor. Which of those you think you should include in the plan of care? What do you think? Pick your answer. Number one, go through them slowly, pause the video, and see which one you should include. But I can tell you, avoid sexual intercourse, otherwise you're going to bleed. And then check the baby, make sure the baby is moving, fetal kick. If you see any blood, let me know. No vaginal exams until I prescribe it. Strenuous exercise will cause more bleeding. Pelvic rest means no vaginal exams. And you don't report to the labor and delivery just because you feel like you're in labor. No, this has to be scheduled. So G is the wrong answer. You don't do that. Report to labor and delivery unit only when you're in labor? No. We have to schedule you. We don't want you to go in labor when you have Previa. After discharge teaching, after the nurse have provided discharge teaching, the nurse obtain a final set of vitals. So she checked the vitals. The client suddenly developed what? Vaginal bleeding. Now she's bleeding again. A blood pressure of what? 88/54, not doing well, and fetal heart rate showing deceleration. Now baby is in trouble, mommy is bleeding, and now she's in shock. What would you do? What does that mean? Is this a uterine rupture? Is it placenta abruption? Is the onset of preterm labor? Or this is maternal and fetal compromise? What condition you think is happening? I can tell you it's maternal fetal compromise. Both of them are in trouble, shock, and baby is not doing well. This is no onset of preterm labor. Mommy is still bleeding, abruption, I would say painful vaginal bleeding, and maternal uterine rupture. It happens when you are in labor. Mommy is not in labor. Which action should the nurse take first then? She's bleeding. Perform vaginal exam to check the bleeding, prepare for emergency C-section, place the client in transdermal position, prepare for emergency vaginal delivery. What do you think we're going to do? Mommy is in shock. Baby is not doing it. Mommy has placenta previa. You pick your answer? I can tell you, there's no more vaginal exams. There's no more vaginal delivery. We got to do emergency C-section. And therefore, transdermal position will make the mommy sick more. Client is now 24-hour post-operatively after C-section. Which of the following assessments should the nurse include? That means postpartum care. What do you do? Select or apply. Assess the lochia for amount and the presence of clot. Assess the uterine fundus for firmness and position. Inspect the incision for redness, drainage, and separation. Assess for calf pain, warmth, and swelling. Perform a vaginal examination. Assess pain level, effectiveness of analgesic. This is postpartum care. What did I do? I put all the things you're supposed to know for postpartum care. I put it there. It's a case study. So you learn everything on maternity. You pick your answer? Yes, we got to check lochia and amount. We got to check the fundus position. Very important. We got to inspect the incision, make sure it's healing. There's no signs of infection. We got to prevent DVT, so check for cough and everything. No vaginal exams at this time. Assess pain level and effectiveness. This is what you do. Nurses in the emergency department is caring for a client with anaphylaxis from a bee sting. The client received IM dose of what? Epinephrine 15 minutes ago without improvement. What is the nurse priority action? Prepare for intubation and advanced airway management. Administer diphenhydramine IV. Administer epinephrine IM. Administer a corticosteroid IV. This is testing your knowledge on what? Anaphylaxis and the use of epinephrine. Pause the video and pick your answer. The right answer is C. Why? Epinephrine, bee sting, we can give it to you every 5 to 50 minutes if you're not doing well. Patient is not doing well. After 50 minutes, is still having issue, keep on giving it before you move on to what? A Benadryl or steroid. Epinephrine still remain as the first agent, so keep on giving it. A nurse is observing a newly licensed nurse performing closed suctioning on a client with endotracheal tube. Which of the following action by the newly licensed nurse require intervention? The nurse observes the new graduate applying clean gloves before performing suctioning. The new graduate sets the suction pressure to 100 millimeter per mercury before starting the procedure. The new graduate suctioned the ET tube for 15 seconds while watching the monitor for changes in oxygen saturation. The new graduate hyperoxygenates the client with oxygen 100% before suctioning. You know it, suctioning requirement and the things you're supposed to do before you suction the pressure. This is what they do. They put in the question. So check which one you think require intervention. That's all. If you know things about suctioning, you pick the answer straightforward. Pop out like a candy. But I can tell you, C is the right answer. You should not suction more than 10 seconds. That makes this wrong. It's a clean gloves, right? It's a closed suctioning, right? If it's not, then it becomes sterile. But this is a closed suctioning, so clean gloves. The new graduate suction 100 to 120 pressure is okay. And you have to pre-oxygenate the client to 100%. So D is also right. And this is caring for a client attempting a vaginal birth after cesarean section. The client develops sudden onset of abdominal pain, absence of contraction, fetal heart rate deceleration. Which of the following complications should the nurse suspect? Placenta previa, placenta abruption, uterine rupture, called prolapse. There's a bunch of buzzwords in the question. Look at it, put it together, figure out what condition that they, and then make a diagnosis. You pick yours? I can tell you this is a uterine rupture. Why? This gives you away. If you have vaginal birth, if after you've already had a C-section, you're more likely to have uterine rupture. The incision can break. That's why most people will go and have C-section. But when we see sudden onset of what? Abdominal pain, cessation of contraction, no more contraction, loss of fetal station, and the baby is not doing well, this is uterine rupture. Placenta previa, painless vaginal bleeding, that is bright red. Abruption, painful dark vaginal bleeding, I don't see that. Cord prolapse, you see the description of cord coming out. There's no evidence in the stem of the question. Therefore, this is your right answer. And this is caring for client in the med-surg unit. Which of the client is at highest risk of developing delirium? This is psychology, mental health psych question. And this is caring for 4 clients on the med-surg unit. Which of the following client is at highest risk of delirium? 72-year-old client who is post-op from hip surgery and is confused but oriented after brief reorientation. A 65-year-old client with the history of Alzheimer's disease who is disoriented at times and responds to verbal cues. A 78-year-old client who is being treated for pneumonia and is exhibiting sudden agitation, hallucination, difficulty following commands. A 60-year-old client recovering from stroke who has mild confusion and alert after rest. You have to know the difference between delirium, dementia, and depression. This is what the test is asking you. Which one is delirium? You pick your answer. But the key is the definition. A delirium has to be acute onset of change in mental status. See your right answer. Why? Patient is being treated for pneumonia. All of a sudden agitation, hallucination, difficulty following command. That's acute. 1. Post-op from hip replacement surgery is confused, but it comes back to normal when you rearrange them. Patient has Alzheimer's disease. That usually rule out. Is disoriented at times and respond to verbal cues. This is not delirium. It's not acute change. A 60-year-old client recovering from stroke who has mild confusion and alert after rest. That's an acute problem. C is your right answer. A nurse manager is reviewing seizure care with nurses on the unit. Which of the following statements by the nurse indicate a need for further instruction? I will turn the client to the side during a seizure. I will loosen restrictive clothing around the client's neck. I will note the duration of the seizure. I will go to the nurse's station for assistance. This is a trap. It's a safety question, but pay attention to the words. Patient reviewing things you need to do when the patient is having seizure. Which information should tell you this need further teaching? Pick your answer, let me know. But I can tell you D is the right answer. It's trappy. It's a little bit look like it's normal, but it's not. When somebody having seizure, you should not leave the patient. Stay with them forever. Let somebody call for help. You should not leave. D is the right answer. Why? When somebody is having a seizure, you should not leave them. It looks like it's a good answer choice, but it's not. It's a bad. You need further intervention. You should stay with the patient, let somebody call for help, or use the alarm bell to call for help. But don't go to the nurse's station and find out and call people. You should know the duration so that you can know if they are in status epilepticus. You should loosen any constrictive clothing, and then you should put the kid on the side to prevent aspiration. So that's the right answer. 30. You are like 1/4 away. And this is where you get tired. Stay with me. The next 10 questions will test your stamina, will test how much you know in terms of various concepts. And this is teaching the client about advanced directives. This is a trap. Which of the following client statement indicate a need for further teaching? That means they don't know what advanced directives is. Select or apply. I will designate someone to make decision if I became unable to. Once I complete an advanced directive, I can't change it. My advanced directives goes into effect only if I'm unable to speak for myself. I should give a copy of my advanced directive to my healthcare provider. Advanced directives are only for people who are dying. Is that true? Pick your answer. Let me know. But thus, like I said, the next 10 questions will test your strength and your readiness. I can designate someone to make decision if I become unable to. Yes, this is the power of attorney aspect of it. When you say advanced directives, they mean living will and the power of attorney. Unless they indicated advanced directives mean both. So if you designate someone to make a decision, that's power of attorney. That's not the further teaching. Once I complete advanced directives, I can't change it. You can change it. You have an option to change it. My advanced directives go into effect only if I'm unable to speak for myself. Yes, it go into effect when you cannot do anything for yourself. I should give, that is talking about living will. I should give a copy of my advanced directive to my healthcare provider. He doesn't care about it. It's for you and your family. Advanced directives are only for people who are what? Dying. I should give a copy of my advanced directive to my healthcare provider. Yes, so that they know they can make a decision about you. Advanced directives are only for people who are dying, not for people who are dying. It's for anybody if you don't dying or not. NCLEX attended staff education program on safe intramuscular medication administration, safe medication administration. This is pharmacology. Which of the following statement by the NCLEX indicate a need for further teaching? This is the fundamental aspect of pharmacology that student makes this question. In my Q bank, I can see that. I will use ventroglucoside for IM injection whenever possible. I will aspirate before injecting medication into the deltoid muscle. I will use the Z-track method for irritating medication. I will use it for irritating medication, solution in oil, and aqueous suspension. Which one need further intervention of IM medication? You pick your answer. I can tell you, you should not aspirate no matter what. Don't. But you can use a Z-track. When we use it for irritating medication, we use it for solution in oil, aqueous suspension, and the best place is the ventral gluteal. That's the concept that you should write it down. And that's where I put it here. And this is caring for a laboring client who is receiving an epidural for pain. Which of the following finding would the nurse report to the provider immediately? Know the side effect of epidural and know what you need to do. Client report feeling pressure during contraction. Client became pale and report nausea, mild itching at the epidural site, a decreased sensation in the leg. If I give you epidural and you labor, which signs or symptoms do you think I should worry about? Risk reduction, caution. This is prioritization. This is what form bulk of your NCLEX. That's why I said this will determine you passing or not. I can tell you, epidural causes hypotension. If I put hypotension there, you pick it. But I put pale and report nausea. That's shock. You're going to have what? Pressure during contraction is okay. Itching at the site is okay. Sensation decreasing to your leg because it numb your leg. But if you become pale and report nausea, that is hypotension. You are having shock. A client in active labor is receiving Pitocin IV. Which finding required the nurse to stop the Pitocin? Contraction every 4 minutes lasting 50 seconds. Fetal heart rate 130 beats per minute with acceleration. Contraction every 90 seconds lasting 100 seconds. Variable 6 to 10 beats per minute. That means, what is the question asking? That's what you should find out. Use it to answer the question. Figure out what you need to know. What are the indications of stopping Pitocin if you see this finding? You pick your answer. You pick your answer. But 33 is a wrong answer. And that's the correct one you should pick. What do you mean? Contraction every 90 seconds. It's too short. It should happen more than at least 2 minutes, and it should not last more than 90 seconds. So you can contract at least every 2 minutes, and when you contract, it should not last more than 90 seconds. Your variability can last 6 to 10 beats. That means changes in the fetal heart rate is okay. Fetal heart rate of 130 is normal. If you're contracting every 90 minutes, every 4 minutes, it's more than 90 seconds, and it's lasting 50 seconds. It's less than 90 seconds. So that's better than C. And this is what caring for several clients on a med-surg unit. Which of the following action by the nurse violate client confidentiality? Selected apply. 2026 test plant information that you may be tested on client confidentiality. Discussing the client diagnosis with another nurse involving the client care. Leaving a client chart open at the nursing station where visitors can view it. Posting about a client condition on social media without including the client's name. Sharing client information with family member upon request. Giving report about a client during shift change in the private area. What do you think violates the client confidentiality? HIPAA violation. Pick your answer. Select or apply. Don't over-select. Pick those that you're 100% confident. But I can tell you, discussing the client condition with another nurse involved in your care is right. Leaving the chart, however, in the open place that anybody can see is wrong. Posting on social media, even if you don't include their name, is wrong. And in sharing information with the client family upon their request is also wrong. If you give a report in a private area to the nurse, it's okay. So those are violations. And nurse is caring for a client in labor who has what? Intrauterine pressure catheter. Another question, like I said, I'm trying to help you pass the NCLEX when it comes to this new generation, new changes they put in there. And I'm giving you questions that you should know. So intrauterine pressure catheter, which of the following finding indicate is properly functioning? This question is not hard. I will show you. If you get it that right answer, that means you master adapt NCLEX strategy. If not, there's a way I will show you. Continuous fetal monitoring, fetal heart rate monitoring. The monitor show variability in the fetal heart rate. The clients report increased perception of contraction. The monitor provides quantitative measurement of the uterine contraction. Which one indicate that intrauterine pressure catheter is properly functioning? Pick your answer. I can tell you 35, the right answer is D. Why? Intrauterine pressure catheter is measuring pressure of the uterus, right? Which answer choice provide that? Right? A monitor provide quantitative, that's measure of the uterine contraction, that's the pressure. The client report increased perception of contraction. There's no measurement here. The monitor shows variability in fetal heart rate strategy. It is measuring fetal heart rate, not the intrauterine pressure monitoring, measuring pressure of the uterine contraction, not the fetal heart rate. Don't pick B, it's a trap. And don't pick A. Continuous fetal heart rate monitoring is measuring the baby, not the contraction of the mother, of the uterus. You see, fetal heart rate, mommy perception has nothing with the instrument measuring contraction pressure. Therefore, D is your right answer. A nurse and a UAP enter the room of a client with dysphagia who is eating. The nurse immediately observed the client attempting to talk but was not able, choking. I've analyzed everything. Patient is choking. Which action is appropriate for the UAP? What do you think the UAP would do? Perform NCLEX maneuver, activate emergency response system, assess the client coughing ability, check client mouth for residual food. UAP, what can they do? You pick your answer? Of course, all they can do is activate the emergency response system. Performing this procedure requires some help, indication, and then teaching from the nurse, and also making sure we know what we're dealing with. Assess the client coughing, an assessment is not there, and the client checking the mouth for residual food is an assessment. Therefore, B is the right answer. And this is providing teaching to a client who has endometriosis. Which statement by the client indicate the need for further teaching? That means they don't know what is endometriosis. I may experience pelvic pain during what? Menstruation. I might have pain during what? Sexual intercourse. This condition can cause increased fertility. My symptoms may be managed with oral contraception. What do you think? Pick your answer. Don't get trapped. Pay attention. Stay focused because you are in the danger zone now that you get tired and you are fatigued. Regroup. But the right answer is what? C. Endometriosis does not cause increase in fertility, it causes decrease in fertility. You're going to have pelvic pain because of scarring. You're going to have pain with scarring, and therefore sexual pain is going to be painful. And then you can manage it with oral contraception because you control your menstruation. Next, care for a client in active labor. The provider requests more precise assessment of uterine contraction. The nurse places a device that provides quantitative measurement of what is a uterine contraction intensity and display the data numerically. Which of the following monitor device is being used? This is what the NCLEX said they're going to test you in 2026. So master them. External tocodynamometer, fetus cap electrode, intrauterine pressure catheter, Doppler ultrasound transducer. Which one corresponds with the information in the question? If they give you these technical questions, all you need to do, read the question again, find the terms, and reinterpret it into this. You pick your answer. This is the same as intrauterine pressure. Look at it. The device is going to what? We want a precise assessment of uterine contraction. Which one measure uterine contraction? At the same time, we got to place the device that will measure quantity of intensity and display the data. External tocodynamometer, what does it do? The duration and the frequency. It does not measure pressure. Fetal cap electrode, it measures the baby fetal heart rate. Doppler external transducer, it measures fetal heart rate externally. Intrauterine pressure device catheter measure pressure in the uterine contraction. And let's discover a small paper fire in the trash can in the client's room. The client has been moved to a safe place and the fire alarm has been activated. Which of the following actions should the nurse take next? Evacuate other clients from the unit, open the window in the client's room to allow smoke to escape, extinguish the fire using a Class A fire extinguisher, turn off the oxygen supply in the room. What do you think? You pick your answer. I'll break down the question for you after you pick your answer. I know you pick it, but this is what you do. What should you do next? Okay, there's a fire. It's a small paper fire. What we do, we already rescue the patient. Therefore, what should we do? Take care of the fire. Evacuate other client from the room. The thing is already been taken care of. There's no any other client. If I want you to know there's another client, I'll say it. If you open the windows, you need to close them to contain the fire. Extinguish the fire using what? Class A fire extinguisher. That's what you do. And turn off the oxygen supply in the room. It looks tempting, but you still have to turn the fire before you take care of it, before you deal with the oxygen. Very, very important. Client has decided to use cervical cap for contraception. When instructing the client in the correct use of the method, which action should the nurse include? Insert the cap no longer than 3 hours prior to intercourse. Apply the spermaticide to the what? Outside of the cap. Remove the cervical cap within 6 hours after intercourse. Reapply spermaticide with the repeated acts of intercourse. This is a traffic question, a lot of keywords I'm going to show you so that when you see it for question 40, you never forget. You pick your answer. You pick your answer. But I can tell you the right answer is what? D. When you use cervical cap, you have to apply spermicides. This is going to help with what? Killing the sperm, and is part of the contraception method. The removal of the cap within 6 hours, that means it becoming effective. You got to keep it at least 6 hours, and it can stay to 48 hours. Apply the spermicide to the outside of the cap. You should place it what? Inside, not the outside, so they can do his job. Insert the cap no longer than 3 hours prior to intercourse. There's no time limit when to insert it, so far as it's there before you have intercourse. It's a form of contraception. That's your right answer. At this point, you've answered for the question. In the NCLEX, this is where your anxiety kicks in. You keep on asking yourself, when does this end? This is where your anxiety kicks in. Take a break, 2 seconds, close your eyes, and start answering the question again. Which client statement indicate the need for further teaching? A nurse is teaching a client who has a new prescription for what? Clomiphene. This is health promotion, but pharmacology aspect of it. I may experience hot flashes and mood changes. I might have twins or triplets. I will take the medication 14 days after my menses. I will not be protected against sexually transmitted infection. Which one need further teaching? The key word in the question is clomiphene. What is clomiphene? And which of these need further teaching? What kind of teaching you should provide? To answer the question, pause it, think about it, answer it based on your content, and I'll give you the answer. But I can tell you what C is the right answer. Clomiphene is used for fertility. Women who cannot have babies, they have infertility, they have other conditions preventing them from having babies. Clomiphene will improve ovulation, and because of the way it acts, you release more eggs and causes you to have ovulation. In the process, you are more likely to fertilize those eggs and have multiple babies, twins, triplet, quadruplet. So B is the right answer. You may have hot flashes and mood change because of estrogen level that is increased. It does not protect you against sexually transmitted infection. If you need ovulation, then you should take the medication earlier in your menses so that you can have ovulation, not 14 days. So this is usually taken in the first, second, third, up to the 5th day when you start your menses. So by the time you finish, you're really ready to ovulate. So that's why this is the right answer. That's the pharmacology. And this is reviewing fire safety procedure. Match each type of fire extinguisher with the appropriate fire source. There's different extinguishers based on the fire that you're dealing with. Know these ABC different fire standard. Please know them. This is a safety question, NCLEX safety question. What is Class A fire, Class B fire, Class C fire, and how do you combat them? That's all. You pick your answer. Class A fire is anything that is combustible. So those are easy ones. Class B is talking about liquid gas fires, right? They are flammable. Those are Class B. But anything that is combustible, papers, anything like that, those are all what? Class A fire, simple ones. B, flame, liquid, and gas. And if you have electric fire, dangerous one, these are Class C fires. Watch for it. Therefore, if you need to combat them, take an extinguisher that can take care of Class C fires. That's all. And that's your right answer. And is prepared to apply restraint to agitated client, which action is required to remain legally compliant. Obtain a provider order within 24 hours, tie restraint to the side rail, assess circulation every 4 hours, use restraint as a last resort. Which one will make this legally comply? Pay attention for the words, the big words in the question. Pick your answer and let me know. Which one? The right answer is this. This is what will make this legally compliant. Of course, assessing their circulation 4 hours is too much. 2 hours, every 2 hours. You should not tie the restraint to the side rail, non-movable aspect of it. Order provider order within 24 hours. Yes, you can order it. I know a lot of people will pick A. Okay, provider provide me an order within 24 hours. But restraint to be legally necessary and compliant is we need it as the last resort. Just because you think you can obtain order from the provider, you're going to get the restraint order. No, if you have to make sure it's necessary to do this restraint, then you can go. This is what make it legal. It's the last resort. Always use least restrictive mechanism. But if you can't, obtain it. Next generation NCLEX. You ready? I know you're ready. Let's get to it. This is a case study. Look at it. Find the buzzword in the first two sentences. Underline it. Make sure every sentence fulfill that requirement. 70-year-old client admitted to the hospital 2 days ago with pneumonia. That's your first thing. Why are you in the hospital with pneumonia? Do you have infection associated with pneumonia? The client has a history of hypertension and mild cognitive impairment. Okay. During morning assessment, the client suddenly became confused, disoriented to time and place, and attempting to get out of bed. He's restless, he's agitated, new opioid prescription given overnight. So patient had opiate overnight. Patient previously was alert and disoriented. Think about it. I have been admitted 2 days ago. I'm fine. All of a sudden, I had opiate last night, and this morning, I'm confused. I'm disoriented. I'm pulling IV lines. I'm trying to get out of bed. I have low-grade fever, consistent with my pneumonia. Tachycardia, consistent with my pneumonia or whatever is going on with me. My blood pressure is okay. My saturation is okay. On exam, I'm restless. I'm agitated. My lung sound is caused because I have pneumonia, right? My abdomen is fine. Arthritis is fine. What do you think? If you're taking care of this patient and you see this patient fine, coming in for pneumonia, all of a sudden, going crazy. What do you think? This is what? Is this depression, dementia, delirium, psychosis? It cannot be depression. There's no evidence in the case study. Even though he has mild cognitive delay, this is not the problem. This is an acute problem. Don't pick it. This is a distraction. The depression, dementia is done to distract you. But the key is delirium, acute change in what? The sensorium. Psychosis, no, the patient is no hallucination or doing anything like that. Which action should the nurse then take? If I have a delirium, what would I do? Reorient the client frequently, apply restraint immediately, ensure adequate oxygenation, provide a quiet, well-lighted environment, and initiate one-to-one sitter. Pause the video, answer the question on your own. And what do you think? Of course, we got to initiate one-to-one sitter because he's getting out of bed. Make sure they provide quiet environment and the place is well lit. You need oxygen, right? What do you think? Hypoxia can cause that. He has pneumonia. We should not apply restraint and reorient the patient frequently. Select two assessment finding the nurse should monitor closely. What do you think based on the condition? Do we monitor his saturation, level of consciousness, blood pressure, bowel sound, remote memory? This is the patient. Which one we're going to monitor closely? What do you think? Which one we're going to monitor closely? We're going to check his oxygen saturation because he has pneumonia. Hypoxia can cause a problem. And we're going to check his level of consciousness. That's what is going on. He's disoriented, he's confused, trying to get out of bed. But his blood pressure is fine, his bowel sign, we don't need to worry about. His remote memory, he has mild cognitive impairment. I don't need it for that. 6 hours later, the nurse observed increased agitation. Patient is now more agitated. He's pulling IV lines. His saturation is now 88. What do you think is going on? What does this indicate? Is he improving? Is it stable condition? Is it delirium worsening? Or this is medication effectiveness? You know, pick your answer. And you know this, that this is delirium is worsening based on the condition. Therefore, what should the nurse do first? I have a patient who is delirious, is worsening. Should I notify the provider? Should I increase oxygen delivery? Should I call the rapid response team? Should I move client closer to the nursing station? What do you think is the most important? What do you think? The patient may be still hypoxic, so increase oxygen delivery to help with the condition. That may help. Of course, we're going to talk to the doctor, notify them. We're going to call rapid response. We're going to move the client closer to the nursing station. The last thing that you do that does not require order is the first thing, oxygen delivery. The next, review the medication list for the client. Which of the following medication may have contributed to the client condition? Select and apply. So you look at the medication that patient is on. What do you think may have caused delirium? Diphenhydramine, oxycodone, prednisone, lisinopril, lorazepam. What conditions, what medication can cause delirium in an older patient? He's 78 years old. There's something we call Bayes criteria. If you know it, you can use it to answer the question. What do you think? Anticholinergic, bad problem. Opiate, bad problem. Steroid are okay. Antihypertensive can be, but this patient is already what? Hypertensive, so he's already taking this medication. And benzodiazepine are bad problem. This is a case study on what? Delirium patient. Watch it. NCLEX been asking this frequently. I want you to master how to approach them. And this is caring for a client in the emergency department with frostbite of the hand. He has frostbite. This is safety, but at the same time, risk reduction question. Which of the following action by the nurse require intervention? That means, how do you manage frostbite? When you see this question, rewrite it. Patient has frostbite, require intervention. Your brain should tell you, I'm looking for things the nurse is doing the wrong thing. Safety, we got to intervene. So risk reduction. Immerse the hand in the warm water at this temperature. Massage the affected area to increase circulation. Apply a heating pad directly to the hand. Placing dry sterile dressing between the fingers, addressing analgesic prior to rewarming, and administering tetanus vaccination. Break down the question. I will help you find the answer. What do you do? Go back to the frostbite. Know what has happened to the hand. What would you do to improve function of the hand? And if they do any bad move, is what you require intervention. What are your answers? What do you think? I know you picked the right answer, but I can tell you this temperature is the exact temperature you should rewarm. It's very high, but that is how you can take care of the frostbite. Frostbite is where the individual hand is exposed to a bunch of low temperature, and then the tissue start having issues. You have freezing of cells and everything, and they look like they having necrosis, tissue dying. Therefore, we got to rewarm them quickly, and this is the temperature we use. If you massage the hand, you're breaking the tissue. That's a bad thing. Even though it's there to increase circulation, the only thing that can increase circulation is rewarming. If you massage it, tissue is going to die. Apply a heating pad directly to the hand. You should not apply it directly into the hand through something. And then you have to put a sterile gauze between the fingers to absorb all the temperature, the low temperature. They need pain medication because when you warming them, it's very, very painful. So this does not require teaching. And they need tetanus vaccination. So you got to check their status. And so these are things you do for frostbite. And this is auscultating a client's lung sound. Which of the following findings are considered adventitious breath sounds? Select or apply. If you see these questions before and you've got them wrong, today, I want you to pause the video, answer it, write down the concept. Don't leave. This is what can help you because these are fundamental questions on respiratory that you will see it. But they are straightforward. They are intimidating. Pick your answer. Let me know. Adventitious breath sound. Which of this? I will tell you. Learn one side. Adventitious breath sound are what? What do you think? They are abnormal breath sound. That means not what you hear in a normal situation. That's all. If I don't hear it at normal situation, I know crackles is not something you hear normally. Wheezing, when somebody is wheezing, something is bad. But these three things, write them down. It's either you have vesicular breath sound that's normal, bronchial breath sound that is normal around the bronchial area. And if you combine them, you have bronchial vesicular sound. They are the same. So bronchial, vesicular, and bronchiovesicular, these are normal breath sounds. So they are not considered adventitious. If you're struggling, it's not normal. Therefore, this is an adventitious breath sound. Write this concept down. You will never miss any long sound, except if they ask you what kind of sound is it, they describe it. But to find which one is normal and which is not abnormal, this is the concept I've given you. So pay attention to that. The other way you can remember them is as called crawl, crackles, rhonchi, wheezing, and stridor. They are all abnormal. Crackles, rhonchi, wheezing, and stridor. But these are bronchiovesicular are all abnormal sound. Which of the following actions should the nurse take first? Prioritization, management of care. A nurse obtain a positive fetal fibronectin test for a client at 29 weeks of gestation who report mild uterine cramping. Which of the following actions should the nurse take first? Maternity Pharmacology. Reassure the client this is normal at 29 weeks. Prepare the client for administration of beta medicine. Instruct the client to increase oral fluid intake and prepare to administer Pitocin. You have to know what is fetal fibronectin. That's number one. You have to know what it means when you see it at anything 29 weeks. That's all. That's what the question is asking you. What do you think? The presence of fibronectin before 22, 25 weeks is normal as the placenta is maturing. After that, after 20 weeks, 22 weeks, we have a problem. You see fibronectin below 22 weeks, that's normal as the placenta matured. And then it come back again close to delivery, 20, 37, 38, 39. That means placenta is ready to let go and the baby need to be delivered. If you see in between that 29 weeks when the baby is not ready to come out, this is preterm labor. We have a problem. The baby is going to come out. So what you're going to do, give them steroid to basically help their lung function. This is not normal at 29 weeks. Oral fluid is not going to cost them anything. If you give them Pitocin, baby is going to come out quickly. So that's the key. So a positive fibronectin 28 weeks indicate preterm labor, which will help with the development of the lung. Which of the following condition is most likely the client is experiencing? You have type 2 diabetes patient present to the emergency room with severe indigestion, fatigue, shortness of breath. The client denying chest pain. Which of the following condition is most likely the client is experiencing? Gastroesophageal reflux, panic attack, myocardial infarction, pulmonary embolism. What do you think? Pause the video. Answer the question based on your content I've given you. But I can tell you, this is myocardial infarction. Patient is having heart attack. Why? Diabetes patient, they're very atypical in their presentation. Diabetes, because of the neuropathy, they usually don't have true chest pain. That's why they deny chest pain. But they will consider their chest pain as indigestion. They get tired and they have pulmonary symptoms. This is classic diabetes patient having myocardial infarction. This is not panic attack. I'll tell you their heart rate is racing. This is not pulmonary embolism. I can tell you patient is probably bed rest. They're traveling for a long time. And this is not gastroesophageal reflux. I will tell you, baby, when you eat, they have a reflux or sleep at night. Therefore, this is myocardial infarction. And this is caring for a client admitted to a mental health unit who is experiencing significant paranoid. Patient has paranoid disorder. Which of the following interventions should the nurse include in the plan of care? Select or apply. If you're taking care of a patient who is paranoid, what should you include in the plan of care? This is psych nursing. Use clear, simple communication when interacting with the client. Gently touch the client to develop rapport. Encourage the client to challenge the paranoid thought directly. Maintain a consistent schedule and staff assignment. Offer food in seal or package containers. Whisper with the other staff members near the client to avoid agitation. The paranoid patient, you have to know the cluster. But this is cluster A patient. How do you treat them? What are the things you do? This is how you master mental health. There's different of personality disorder. Cluster A this is one classic patient. How do you take care of them? Pick your answer. Let me know. But I can tell you, if I'm paranoid, I think you're going to kill me. I don't trust anybody. You're supposed to use a simple communication, right? Don't make it difficult. Don't touch me until I tell you to. Therefore, gentle touching the client to develop rapport is a trap. Encourage the client to challenge paranoid thought. No, you can't tell them. They should not challenge it. Maintain a consistent schedule and staff. Yes, those they've already trusted, let them be the ones seeing them. And then because they think you're going to poison them, food has to be sealed, packaged. Nobody have opened it before. They will take it. If you whisper in front of them, they think you're talking about them. This is how you take care of them. A client has just experienced a stillbirth. The parent asks the nurse if they can hold their baby. Which of the following respond by the nurse is appropriate? It will be better if you don't see the baby right now. I can bring the baby to you when you are ready. This may be too upsetting right now. I will check with the provider first. What is it? Therapeutic communication, psych. What would you do? They had a stillbirth. They said, I want to hold the baby. What should you do? Let them do it. I can bring the baby to you when you are ready. Excellent. It will be better if you didn't see the baby right now. That's a wrong answer. This may be too upsetting right now. I don't care. I want to see the baby. I will check with the provider. No, that's not therapeutic. And as a screening client for risks of developing herpes zoster, which of the following client is at highest risk of developing shingles? Who do you think is more likely to develop shingle? 25-year-old client with no history of varicella, 70-year-old client receiving chemotherapy, 30-year-old client who recently received the varicella vaccine, a 40-year-old client with seasonal allergy, who is likely to receive what? Shingles. This is a trappy answer, but you know it. Bring the content. How do you develop shingles? Think about it. You pick your answer? I can tell you, B is the right answer. Why? How do you develop shingles? Think about it. How to develop shingles. If you have previous infection, right? If you have previous infection due to varicella and you become immunocompromised, that's when you develop shingles. If you never had a history of infection, you get what? Active infection. You can't have shingles. If 30-year-old client who recently received the vaccination is being immune, a 40-year-old client with what seasonal allergy, it has nothing to do with it. But if you're receiving chemotherapy and 70-year-old, most likely you've been exposed before, and therefore you become immunocompromised. And what will happen? You develop shingles. That's that patient. And has received the following discharge prescription for a client 4-year-old after a tonsillectomy. Which prescription? The nurse should question: acetaminophen elixir, Motrin elixir, Lysogens, Codeine elixir. What the question is asking you: which patient who is 4-year-old should not take this medication after tonsillectomy? What do you think? You pick your right answer? I can tell you D is the right answer. This is pharmacology question. It has nothing to do with tonsillectomy. It's safety. A 4-year-old giving them what? Codeine usually will make them really respiratory, and they may have other conditions. All these things is accepted. And D is unacceptable. Child can have respiratory depression from it. And it's a big thing when they have tonsillectomy. It can affect their airway and they may have aspiration. Therefore, acetaminophen, Motrin, Lysogen to numb the area is good, but codeine should be avoided in the kid. And nurse is caring for a client who has systemic lupus. Which of the following findings should the nurse identify as highest risk of priority? That means any condition patient who have systemic lupus, which of those should you worry about? That's all. Every question, I'll just give you the gist. That's the concept. I look at the systemic lupus and I say highest priority. What should I worry about? Every question you answer, if you do that, the question will become easy. Don't use the question to answer the question. Use your own, but make sure you use the keywords. Systemic lupus, highest priority. That means if I see fatigue and low-grade fever, should I worry about it? If I see facial butterfly rash across the cheek, should I worry about it? If I see proteinuria and hematuria, should I worry about it? If I see joint stiffness and pain, should I worry about it? Of course, you should worry about proteinuria and hematuria because you have kidney failure now. Lupus, if it affects your kidney, you are in trouble. That's lupus nephropathy, or carditis. If it affects your heart, it's a problem. This is manifestation of bad problem. Low-grade fever and fatigue, expected finding. Facial butterfly rash is the classic symptoms of systemic lupus. And then we have joint pain, stiffness. That's not a problem. Which of the four, a nurse is observing staff member administering medication to assigned client. Which of the following action by the staff nurse require intervention by the nurse? Administering terbutaline to a client who is in preterm labor. Administering butaphenol to a client who is in active phase of labor. Administering magnesium to a client who is experiencing preeclampsia. Administering metanoganoven to a client who has migraine. This is pharmacology by its prioritization. Look at it. How do you answer the question? Require intervention. Which client is being given wrong medication based on their condition? That's the question. Read it like that and you master it. Now look at it. Should I get terbutaline if I'm preterm labor? Should I get butaphenol when I'm active phase of the labor? Can I get magnesium when I'm experiencing preeclampsia? Should I get metanoganoven if I have migraine? You see the way I read it, it make the answer choice easy. It pop out like a candy. Of course, you got to pick D because metanoganoven, look, it causes vasoconstriction. If you have migraine, it's going to worsen your migraine. You're more likely to get stroke. If you have preeclampsia, you can get magnesium. If you are in active phase labor, you can get butaphenol. If you're in preterm labor, you can get what? Terbutaline to slow you down. Pharmacology, maternity. Which of the following statement by the client indicate the need for further teaching about the procedure selected apply? The nurse is providing teaching to a G1P0 client who is scheduled for what? Quadruple screening. Which one need further teaching? Let me break it down for you. Patient is getting quadruple screening. We use it for pregnancy. First, second trimester, that's when we test it. You have to know what is in quad screen. What are the lab work they check during the quad screen? Like you do for glucose tolerance test. What are the lab work do you do for quad screen? And if the patient says something out of the ordinary that is not consistent with the quad screen, that's the answer choice. The test will screen for what? Trisomy 18. True or false? The test will screen for Down syndrome. The test will screen for neurotube defect. The test will screen for holes in my baby's abdominal wall. The test will determine my baby's gender. What do you think? What do you think? Which one need further teaching? Not the right answer. I can tell you, the test is going to screen for trisomy 18. This is what you do, genetic testing. We do it during the quad screen. It also screen for Down syndrome. It does not diagnose it. That's trisomy 21. Let's also look for alpha-fetoprotein, and therefore you can determine neurotube defect. The test also can look for what? Alpha-fetoprotein, that we can determine whether you have what? Gastrochesis or omphalocele. That's a hole in the abdominal wall. That's hernia, but it doesn't determine the gender. Therefore, this is the right answer. But this is what the test checks for. It's screened for neurotube defect, Down syndrome because of alpha-fetoprotein, and the trisomy 18. And then you look for abdominal wall defect, but not the sex of the individual. And which task can be delegated safely to a UAP, selected apply? Measuring vital signs on a stable patient, assisting the client with bed to chair transfer, instructing the client on incentives spirometer use, documenting intake and output, performing a steroid dressing. A UAP, anything that does not require taking, an ADL. Stop the video, pick your answer, and you know the answer. What do you think? They can measure vitals. They can assist into the chair, ADL. They cannot instruct, but they can document intake, no steroid dressing. Another case study, this is mini case study because it's a simple, straightforward one. Which of the following the nurse should include in the plan of care? When you see these short case study, just read them, find what is wrong, and answer them. 6-year-old child with the history of cystic fibrosis. And so what? Was admitted with what? Worsening symptoms. So we have exacerbation of cystic fibrosis. The parents report that the child has what? Persistent productive cough. That means they have pulmonary issue with the tick secretion. That's what you expect. Decreased appetite. They're not eating, and they have frequent bulky, foul-smelling stool because they have cystic fibrosis. They can't absorb certain things. The parent also states the child has difficulty keeping up with the peers. Well, because he's not that strong during physical activity and appear fatigued than usual, expected finding. Temperature is high, tachycardic, blood pressure, saturation is very low, and the respiratory rate is high. He has lost a lot of weight. He's alert oriented. He's crackle, wheezy, on auscultation because he has lung problem. Regular rate and rhythm, fine. His abdomen is distended because he has cystic fibrosis and there's digital clubbing of the fingers due to hypoxia. All he's telling you is exacerbation of cystic fibrosis. Don't worry about every little thing. If you know the concept of the case study, that's all you need. You diagnose it, you know what the situation, and you use it to answer the question. What did he say? Which of the following should the nurse include in the plan of care? Do you check the kid daily weight? Do you obtain prescription for fat-soluble vitamins? This should say fat-soluble vitamins. Do you administer pancreatic enzyme replacement with meal? Do you provide high-calorie, low-protein diet? Do you encourage decreased sodium intake? Do you schedule chest physiotherapy 30 minutes after meal? Do you restrict fat intake to reduce tutorial? What do you think? If you have exacerbation of cystic fibrosis in this patient, what do you think? We're going to measure the baby weight, the kid weight, because he's losing weight. That's one. That's fine. We're going to prescribe fat-soluble vitamin because they cannot absorb fat-soluble vitamin. They cannot metabolize fat, so they cannot absorb it. We're going to administer pancreatic lipase with meal. D is a trap. We need high calorie, but we need high protein, not low protein. We should encourage increase in sodium, not decrease it. We should schedule chest physiotherapy 1 hour before meal. And if they have eat after meal, you should schedule it 2 hours. Otherwise, they're going to have aspiration. You should not restrict fat because they're going to have what? Steatorrhea. You still give them high fat to get their calorie, but you give them enzymes and fat soluble to help with that. Therefore, what are your riders? It's A, B, and C. These are all concepts put in disguise that I want you to pay attention to so that when you see a question, you can use to answer it. And this is assessing a client who is taking combination oral contraception and report missing a dose yesterday. She's taking oral contraception combination. That means progesterone, estrogen. She lost, she makes a dose yesterday. What will you tell her? What should the nurse instruct the client to do? Take 2 pills today and continue with the regular schedule. Take 1 pill now and skip tomorrow's dose. Stop taking the pill for the rest of the month and use backup method. Wait until the next cycle to resume your pill. You know the strategy. What do you think? They will ask you this. Patient is going to ask, what are you going to teach them? At promotion. You just take 2 pills and continue with the regular schedule because you mix one and you got to take today to one. Take 1 pill now and skip tomorrow. Why do you take tomorrow to now and skip tomorrow? Then you mix it again. You cannot stop it again unless you've mixed it for like 3-4 days. Then you can do that. So C is the wrong answer. An orthopedic floater nurse is assigned to the med-surg ward due to what? Nurse shortage. Which of the following assignment is appropriate? So the orthopedic nurse went to the med-surg. He said, what? Floater nurse. Give them something every nurse can do, not anything specialized to med-surg. A client with a new diagnosis of DKA receiving insulin infusion. A client with acute chest pain awaiting cardiac enzyme results. A client with pulmonary embolism requiring what? Receiving thrombolytic infusion. A client 6 hours post-operatively following removal of appendix. Which one is okay to give to a floater nurse from orthopedic to your unit? Give them something that is easy. Which one? Of course, appendix, doing fine. Thrombolytic, they don't know how to do it. Cardiac enzyme, they have to monitor the patient seriously and then continuously and closely. And then diabetic ketoacidosis, the same thing. Too complex for the ortho nurse. And this is caring for a client who follow a kosher diet, normal 60. Which of the following dietary practice should the nurse anticipate, select, or apply? Allow meat from animal that eat what? Vegetables. Allow meat from animals that chew their cud and have cloven hooves. Allow meat from animals that are properly slaughtered. Allow fish with fins and scales, including shellfish. Prohibit pork and what? Must consume meat and dairy product at the same level. This is religious question, but it's part of psychosocial, mental health question. And NCLEX will ask you, what do you think? What is kosher diet? If you know kosher diet, then which of those should be included as a daily practice of kosher diet? What do you think? They don't allow meat from animals that eat vegetables. No, no, no. They allow meat from animals that chew their cud and have cloven hooves. That's what they do. The animal has to be properly religiously slaughtered. So that's that one. Allow fish with fins and scales, including shellfish. Is that what they do? The fish that they allow should have fins and scales, but not shellfish. Therefore, this is wrong. They don't like pork. And the meat and dairy products should be not eating at the same time. So that's the thing. They should separate the meat and the dairy product from the animal. And therefore, that's the right answer. And this is the kosher. Very, very specific. So watch for this kind of tricky question, especially D. They allow fish with fins and scales, but not shellfish, right? That's the key. The animal has to be slaughtered properly. They must have their clothing and they chew their cud. Okay. Pork is restricted. And then the meat and dairy must be separated. This is kosher rule. Know it. Watch this portion of the question. Know the answers and the way I've explained it. If you have questions, put it in the comment section, number 60, and I'll add more content to it. Now, you have 10 questions because of the 3 case study. We're going to end at 70, but it's 85 questions in total. This is why the NCLEX will break you. This is why you feel like, hey, when the test is going to end? Don't stop. Stick around. These questions are going to be challenging. You may see it, you may know it, but be careful when you pick them. There will be some that may distract you. One of these is this. And it's teaching newly licensed nurse about the care of a client who is a Jehovah's Witness and requires surgery. Which of the following intervention are appropriate to include in the teaching? Select or apply. Administer iron supplementation. Use intraoperative cell saver. Prepare for autologous blood transfusion. Administer Hypotin alpha and use plasma expanders. What do you think you should do in this situation? Pick your answer, let me know. But to pick your answer, go back to the buzzword. Which of the following intervention is appropriate? That means appropriate teaching. And this is teaching a newly licensed nurse about the care of a client, Jehovah's Witness. They don't want blood, right? So how would you improve blood supply for them? You give them iron. Easy way, right? You can use their own blood. That's intraoperative cell saver. Blood come out, you give it to them. Prepare for autologous blood transfusion. They don't want blood. Administer Hypotin alpha. This will increase red blood cell. And you can use plasma expanders. This will help that. But autologous blood transfusion, you can give it to them. They will not take it. Not everybody will take that, especially if it's stored. So they will refuse it. Which of the following action by the nurse is a priority? And nurse provide care for a client receiving IV erythromycin. Like I said, these questions, 10 questions, be careful. Know this concept. I put them here to distract you, force you to think. Obtain liver function test, continuous electrocardiographic monitoring, request for ondansetron to treat for anticipated nausea, monitor white blood cell. Which action is a priority for a patient receiving erythromycin? You pick your answer. Is B. It's a macrolide. These are macrolide. Macrolide causes QT prolongation, and therefore, when a patient is on IV erythromycin, cardiac monitoring because of cardiac QT prolongation. Ondansetron causes QT prolongation, so you should avoid it. Liver function test is not a priority, or white blood cell is not a priority because it's going to take care of the infection. So that's not a priority. Your last next generation question. Are you ready? Let's get to it. And this is the emergency department is caring for a 24-year-old client who presents with sudden onset of ear pain after diving into a swimming pool. The client report, I felt a pop in my ear, the muffled hearing in the right ear, ringing in the ear and the clear fluid draining from the ear, mild vertigo when turning the head. Temperature is this. There's no acute distress. There's no posterior auricular swelling. When you look into the ear, there's a small disruption noted in the right tympanic memory with minimal clear drainage. Similar question show up recently on the NCLEX based on recommendation. What do you think is happening to the patient? Once again, 24-year-old, he presents with there's a sudden ear pain. One, that's keyword, when they dive into a swimming pool and they say, I heard a pop. Why would you hear a pop? Then all of a sudden your hearing is muffled. You have a ringing in your ear. You have much vertigo, which the nurse has reviewed the clinical data, which finding is concerning. What do you think? Pick your answer, let me know. Of course, sudden ear pain is not something you should not be worried about. Temperature is normal. When we look into the ear, bad stuff, small disruption noted in the right tympanic memory, right? Therefore, otoscopic examination is bad. The ringing in the ear, we don't like it. And the muffled hearing, this is all concerning features. What is the most likely condition the client is experiencing? Is it acute otitis media? It is Meniere's disease, tympanic memory rupture, acoustic trauma. This show up recently. Acute otitis media is infection. Meniere's disease, I'll talk about more vertigo. This is tympanic memory. If you look at the hearing exams, disruption of the right tympanic memory. It's no acoustic trauma. It's no due to sound. The client report worsening dizziness and then nausea after 30 minutes. Which action should the nurse take? Condition is getting worse. Administer prescribed antibiotic. Assist the client to lay down and ensure safety. Irrigate the ear canal. Obtain a culture of the drainage. What do you think? The condition is worsening. Safety is the key. Because of vertigo, you're going to fall. Therefore, put them in the safety position. The client was diagnosed with tympanic memory rupture. The provider would discharge the client with conservative management because that's what you do. You do not need to do just rest, hydration. Which instructions should the nurse include? Avoid getting water in your ear. Blow your nose forcefully to clear pressure. Avoid air travel until healed. Use cotton swab to keep your ear clean. Report increasing pain and fever. You have tympanic memory rupture. We send you home. What instruction should we give it to you? What do you think? Based on the rupture. Of course, don't put water in your ear. It's rupture. Blow your nose forcefully. That will cause more rupture. The pressure change will be a problem. You should not travel until you heal. You should not put cotton swab into your ear. And if you have more fever and pain, especially, you should call us because you may have infection. And that's what happened. 3 days later, the client returned with fever, prolonged drainage, increased ear pain. Which complications should the nurse suspect? You have tympanic memory rupture, all of a sudden, signs of infection. It is otitis externa, acoustic otitis media, mastocytitis, and Meniere's disease. Is that what has developed? What do you think? If you have tympanic memory rupture, the complication, mostly acute otitis media. And that's what this patient has. Otitis externa outside the ear. Mastocytitis is the bone in front of the ear get infected. I'll tell you they have tenderness there. And Meniere's disease, mostly vertigo associated with it. 12 hours later, now not 2 hours, something else happened. The client returned with more fever. Now temperature is high. There's increased ear pain. Now pain is very painful. Ear is very painful. There's more discharge. And then when you have tenderness behind the ear and in front of the ear and slight protrusion of the auricle, this is telling you this is more than something. Is this otitis media, acute otitis externa, mastocytitis, and Meniere's disease? You know the answer. This is your mastocytitis because now involved the bone, you have tenderness behind and in front of the ear. This is our case. It shows up recently, tympanic memory rupture, and how to manage it. What do you teach the parent? What do you need to worry about? A client with UTI is prescribed Phenazopyridine. Which teaching is appropriate when you're caring for this patient? What is that? Phenazopyridine. The medication will kill the bacteria using the infection. It's a selected apply. This will treat the pain and the burning associated with this infection. Wear high glasses during the duration of the prescription. Apply sanitary napkin in your underwear. Expect bright red, orange during discoloration. What do you think? What do you think in the patient who taking Phenazopyridine? Pick your answer. Select or apply. This is not what? Antibiotic, so it doesn't kill the bacteria. This will treat your pain and help with the spasm, burning sensation associated with the infection. You should wear glasses because of the discoloration and photosensitivity during the therapy of the prescription. And you should wear some pad because your discharge will turn colors. And you expect bright red, orange discoloration. This is all teaching you provide to the patient, and that is effective. Which drug combination the nurse should question? That means you should not put them together. And this is aware of several clients on the respective prescribed medication. Which combination should you worry about? Like I said, these 10 questions is like you finishing the NCLEX about to break you. Furosemide, ibuprofen, lithium chlorothalidone, digoxin, furosemide, allopurinol, benztropine, spironolactone, salt substitute. Which one should you question? If you take furosemide, you shouldn't take ibuprofen. Furosemide, get rid of the water. Ibuprofen, bring the water back. Lithium, you should not take any diuretic. Chlorothalidone is a diuretic. Digoxin, if your potassium get low, you have toxicity. Furosemide decreases your potassium, and therefore you can have digoxin toxicity. Allopurinol, you develop second EPS, and therefore we can give you what? Benztropine is good. Spironolactone, what is the problem? Potassium increases. If you take salt substitute, your potassium increases. Bad problem. All this, we got to intervene. Pharmacology, this is testing your pharmacology content. Which assessment finding is concerning? The client report right lower quadrant pain, fever, anorexia, nausea for 24 hours. Which one is concerning? That means if you have a patient who has right lower quadrant pain, anorexia, nausea, fever for 24 hours, and you see this, you should worry. Sudden relief of pain, the pain went away. Pain was at the McBurney's point. Fever 101.5, anorexia. Which one should you worry about? I can tell you. One is the right answer because this is appendicitis. Appendicitis, I should expect anorexia. I should expect fever. I should expect pain. And the McBurney's point, that means right lower quadrant, 2/3 of the anterior superior iliac spine. But if you have sudden resolution of your pain, that's rupture. That's concerning. Peritonitis. Which action is a priority and is provide care for a client receiving fluphenazine for 4 days? Client temperature is now 104. Diaphoresis is irritable. What is your priority? Decrease the dose of fluphenazine. Administer dantrolene as prescribed. Administer cyproheptadine as prescribed. Continue to monitor client vitals every 15 minutes. What do you think? Pharmacology, mental health, psych pharmacology. I can tell you this is the right answer. Dantrolene. The patient has neuroleptic malignant syndrome. Fluphenazine is the first generation antipsychotic. If you have a fever, diaphoresis, and irritability, that means what? Change in what? Autonomic dysfunction. And therefore, we got to take care of it. You can decrease the dose, stop it. Cyproheptadine is used for serotonin syndrome, and you should not be monitoring vitals 15 minutes. This is bad problem. We got to do it. Which assessment finding is the characteristics of rheumatoid arthritis should the nurse suspect select or apply? A nurse is assessing a client with rheumatoid arthritis. Which one is consistent with rheumatoid? This is musculoskeletal, physiological adaptation. Morning stiffness relieved by movement, large joint involvement, unilateral joint swelling, elevated rheumatoid factor on lab, and the presence of uric acid. If you want to distinguish between rheumatoid arthritis and osteoarthritis or gout and everything, which of this is consistent with that? That's all. They have morning stiffness, and then when they move, it feels much better. Unlike osteoarthritis, they have morning stiffness. When they move, it hurts. It does not involve large joints, usually small joint, and involve both sides. So unilateral joint is wrong. You're going to have rheumatoid factor that will be elevated. The presence of uric acid is associated with gout. Two more questions. A client 12-hour post-appendectomy has absent breath sound. There's no breath sound. His abdomen is distended and mild fever is 12 hours. What should the nurse do first? Document the finding, notify the care provider, encourage ambulation, give them analgesic. 12 hours, distended abdomen, no bowel sound. He has mild fever. He just had surgery. What would you do? You should let the doctor know. This is unacceptable. It's not what you should expect. We should do something about it. Walking is okay, but this is more a problem. And then document the finding. You don't do anything, therefore. And the last question. Thank you for staying. 85 question, English practice question, most likely to show up on your NCLEX. This is to build your confidence. Answer this and you pass. And let's provide care for a client prescribed for Phenazine as a new prescription. Which client diagnosis in the client history will cause the nurse to question the prescription? Depression, pheochromocytoma, Parkinson's disease, and diabetes. Sometimes NCLEX last question can break you or make you. You may be below the passing grade, and therefore this is your last question. The computer is going to stop or not, depending on how much, what you do with this question. What do you think? Let this be the one that push you to the edge and get over 65. You pick your answer? Pheochromocytoma. Why? Phenazine is what? MOI. And therefore, MOI, anything that causes your blood pressure to be high. Diabetes, Parkinson, and then depression, no blood pressure issue. Pheochromocytoma, your pressure is high. If you take Phenazine, it's going to blow you up and you get stroke. 85 question, NCLEX practice question, NCLEX practice test, NCLEX review question. Thank you for watching. I know you learned something or the concept you use, put it together, pass your NCLEX and let me know. Take care of yourself and good luck.